This summer, mosquitoes and ticks are out in full force, so preventing and protecting families against the germs these pests spread through their bites should be top of mind, as many of these germs can result in the transmission of serious illnesses and diseases. There are steps to help keep these pests at bay while enjoying the great outdoors. And I'm very pleased, Dr. Jorge Parada, medical advisor for the National Pest Management Association, for us to be discussing this important issue today. Uh, why are tick-borne illnesses on the rise?
Well, there's a number of reasons, and unfortunately, it's a pretty steep rise. Earlier this year, the CDC emitted a report saying that tick and mosquito-borne infections have tripled in the United States in the last dozen years. Now, the reasons are many, and mainly it comes down to that life is good for these ticks, that their range is expanding. The animals they prefer to feed on, mice and deer for the most part, but chipmunks and others, are in abundance, so they have lots of places to eat. It makes it easier for them to grow and multiply. The winters are not as severe as they used to be, so they don't die out as much as they used to, and neither do the mice that they feed on. So you get an expansion of the areas with infected ticks, and that's been very notable. And of course, you have an expansion of areas with infected ticks, you're going to have more humans to get infected. And then, with regard to mosquito-borne infections, you'll remember not that long ago, we didn't have West Nile in the United States. And now it exists in all of the continental United States. So it arrived and it spread. Zika was brand new to our shores. Luckily, we contained it, but for a little while there, it was in Florida, and it threatens to spread across the south of the United States. So there's a host of reasons why these infections have been increasing in number, and of course, it's very concerning.
Right, and what are the serious problems that they cause?
Well, the big problem all depends upon the infection. When it comes to tick-borne infections, Rocky Mountain spotted fever, if not diagnosed in a timely fashion, can be lethal, can kill you. Others, which might be less well known, anaplasmosis, babesiosis, or lichiosis, also can be lethal if not diagnosed and treated. The most common tick-borne infection in America is Lyme disease. Luckily, that is not typically fatal, but it's surely a big burden on America and the American healthcare system, given just the sheer volume of Lyme infections that we see. With regard to mosquitoes, luckily, malaria and yellow fever, which are infamous for being lethal, don't exist endemically in the United States, in the continental United States, but we certainly have West Nile virus, which rarely but can be fatal. We sporadically get a little bit of dengue. We had that little scare with Zika, chikungunya. So there are a number of mosquito-borne infections that can cause significant problems as well.
I see. And what would you say are symptoms that are caused by such things as Lyme disease and West Nile virus?
Okay, well, Lyme disease, usually the first sign that we see is a rash, and it occurs in about 70 to 90% of people who get infected. It's usually a circular reddish rash. It tends to expand, often with central clearing, so you end up with sort of a ring or an annular rash. That's why it's often called a bullseye rash. Its official name is erythema migrans. And so that's the earliest sign, and if you see it, you should go to your doctor, because that's almost certainly due to Lyme disease, and you want to treat it early. Given more time, you often get more dispersed symptoms, body aches, fevers, joint pain, and so these are other symptoms of Lyme disease. You can get headaches and neck stiffness and photophobia, meaning the light can bother you if you get some neuro-Lyme infection, or it can go on to cause a series of palsies or paralysis of nerves. So neuro-Lyme can get pretty complicated. West Nile.
And yes, I was going to ask about West Nile.
So the good news about West Nile is the vast majority of people who get infected actually don't have symptoms. In 80% of cases, it's asymptomatic, or meaning people don't even realize that they've been infected. Only in 20% of people do you go on to develop symptoms like body aches and pain and fever, and up to 50% may have a rash as well, and that we call West Nile fever. Less than 1% of people infected with West Nile virus develop severe West Nile virus, which usually has neurologic involvement, where you may see ascending paralysis, so they become weak in their limbs and their legs, and it starts coming up. They can go into a coma, and unfortunately, you can die from West Nile virus. Now, Lyme, treated early, is very curable, and there's a host of antibiotics that can cure Lyme. And so that's quite good. Unfortunately, for West Nile, we have no treatment and we have no vaccine. We can just give symptomatic relief and support for West Nile.
I see. Now, what should one do if one finds a tick on the body?
Okay.
On a child, on a pet?
Yeah. Very good question. And the short version is there's two things. One is don't panic. That tick is probably going to just stay where it is for a while, so you have time to address it. And the best way to address it, so the second point, is tweezers. Tweezers are the best removal tool and the best way to remove ticks from the body. You apply the tweezers to the tick as close as possible to the skin and just firmly but gently pull back. And that slow but steady pressure will make the tick release and unlatch itself. You don't want to jerk it. You don't want to twist it. That can lead to crushing the tick and leaving the mouth parts behind. So you just slowly pull that tick off, clean the skin, dispose of the tick, flush it down the toilet, and you should be fine.
I see. And also, what does one do to eliminate mosquitoes and ticks from the property?
So there's a host of things that can be done there. First, start by inspecting. If you have cracks, they should be sealed. If your screens are not intact, they need to be repaired. And then you'll want to walk around the property and get rid of any standing water. A ½ inch of standing water is enough for mosquitoes to breed. So you want to make sure all standing water is eliminated, that your gutters and drains work well without accumulating water. And with regard to ticks, you want to get rid of overgrowth. You don't want to have a lot of overgrown bushes and weeds and clutter. The ticks will hide in there, and then you'll brush up against it and get tick bite. And so if you're not sure, or better yet, if you are sure and you know you have a problem, I'd recommend you contact a pest professional to help you in evaluating and coming up with a plan to protect yourself from insects around your home.
And one other question. What are good sources of information that people can get about pest removal, pest prevention and removal?
Yeah, I would direct you to pestworld.org. Pestworld.org. Great resource.
Pestworld.org.
Yes. Great resource, has everything we've talked about and more.
Okay, well, that was very helpful information. I'm sure it will be useful for my Health Power audience, and I enjoyed talking with you today.
Great. You have a wonderful day.